And now to introduce you to the appendix. The appendix hangs off your large intestine, specifically this little pocket called the cecum off of your large intestine, which is where the small intestine empties into the large intestine. At the ileocecal valve. There's the cecum, and then this tiny little thing here is the vermiform appendix. Looks like this when it's nice and healthy. Vermiform means worm-shaped, so it's a little wormy thing. If your appendix is not healthy, then it looks like this. This is a terribly inflamed appendix. This is some of the mesentery that was holding it in. Inflammation sometimes happens because fecal matter obstructs the opening to the appendix and maybe fills it and, well, bacteria, nasty, bad bacteria. Remember, not all bacteria is bad. Anyway, bad things happen, and the appendix can become infected. The infection itself is going to cause a lot of pain in the lower right quadrant. If the appendix burst, the contents can be spilled into the peritoneal cavity, causing an infection called peritonitis. That is going to be very difficult to clean up. It can become a systemic infection, and it can kill you. So be careful of pain in the lower right quadrant of your abdomen. The pain is from the spasms of the smooth muscle lining the walls of the appendix. It is often felt not in the lower right quadrant, but around the umbilicus, around your belly button, because it's referred pain along the T10 dermatome, which we learned about when we were learning about the spinal nerves. How cool is that? More advanced appendicitis is usually felt in the lower right quadrant. So if you go, say, to the ER with belly pain, one of the things they're going to do is feel around in your abdomen to see if they can feel anything wrong. And they're also going to feel that lower right quadrant, right where the appendix is. Generally speaking, if somebody has appendicitis and someone touches that appendix, they're going to scream in pain, and that's a really clear sign that someone has an appendicitis. Okay, so just to show the difference, there's the inflamed appendix, there's the healthy appendix. Very, very different looking. So what is the point of having an appendix? It is kind of a vestigial feature. Other mammals have much larger, more developed structures. And people used to think it was just left over and didn't have a function. We now think maybe it does, and it's part of your immune system. We think that it stores the good bacteria that is needed in your gut, especially in your large intestine, to help get the last nutrients out of your food as it gets compacted into fecal matter. And also, good bacteria helps to maintain the mucus layer in the colon. So that good bacteria might be stored in the appendix, and then after, say, a bout of diarrhea that has emptied the colon, the good bacteria could then repopulate from the appendix. There are a lot of people studying this, trying to figure out exactly what the function of the appendix is. Stay tuned and keep an eye out to find out what it really is. But here is another Awkward Yeti cartoon showing our adorable little appendix. You don't have to remove your appendix just because you don't know what we do.
But if you don't, I will kill you if the urge strikes me.
But I might help your immune system.
Maybe.
That's your appendix.